Hey everybody, welcome back to my channel. If you're new here, my name is Joy and I'm a neonatal nurse practitioner, new grad that just graduated, and so I'm here to share my journey and knowledge with everybody. If you want to know a little bit more about me, I would encourage you to check out my first video. I cover nursing content, travel content, and relocating to Houston content. So if this type of content is something that you like, don't forget to like and subscribe, and then leave a comment below letting me know if you are a nurse, what type of nurse you are, and what other things you would like for me to talk about in my future videos. And then I will see you guys next Monday. I want to start this video off by giving you guys some words of encouragement. If you want to become a nurse and you don't know where to start, I was in the same boat. I didn't know where to start. I didn't know how to find programs. I didn't even know what type of nurse I wanted to be. I just knew that I wanted to get started. So if you're in that position, guess what? I was there, and now I've already been a nurse and I've already graduated, and now I'm a nurse practitioner. So I'm here to help you guys and support you. Okay, so you want to be a nurse. You got to decide, what type of nurse do you want to be? Before you even decide what type of nurse you want to be, I would say the first thing you need to do is listen up. This is a pro tip. You need to go on the job boards that are in your community and look at the description to see what job works best for you. Once you do that, once you figure out what nursing position works best for you, then you need to look at the requirements and see what they require. Some require a bachelor's, some require a master's, some just require a diploma, a certificate. So you need to just go on the job boards. You will hopefully see plenty in your area, and then you'll know where to go from there. Another thing to think about with nursing is that your board of nursing sets the rules. That determines what you can and can't do, and that also changes from state to state. I am from Illinois, and then I have my nursing license in Missouri. And so when I'm speaking, a lot of the things that I'm talking about is Missouri based, but you definitely have to do your own research and look up what your nursing board allows in your state. The different type of jobs that you may be able to do if you are LPN versus an RN is also determined with your location. So if you're in a more rural area, you may be able to do more things as an LPN as far as like working in a clinic or working in a hospital. And then if you're more in a city area, a lot of times the hospitals want you to have that BSN. They are really pushing for it. So that is something to think about. If you want to work in a hospital, they may let you start, but a lot of times it might be you have 2 years to work and then you have to go back to get your bachelor's. So keep that in mind as well. With your nursing degree, you do not have to just do bedside. I mean, nothing wrong with bedside. I like bedside because I like taking care of babies. But the thing to love about nursing is that it's just not like one thing, right? So if you want to do bedside nursing, you can do bedside nursing. But if you want to teach, you could be an educator. If you want to do research, you can do research. If you want to do forensics, you could be a forensics nurse. Like, there's so many different things that you could do. If you feel like the office is better for you and you want to be a nurse administrator, that's something that you can do. So if working in the hospital is your end goal, then you may just want to go ahead and get that RN degree and then bridge over to the BSN. Let's just jump into these different programs. There's different types of nurses. I started as a CNA. A lot of nurses start as a CNA. A CNA is a certified nursing assistant. They are not nurses, but starting as a CNA is a good chance for you to get in the hospital or the nursing home, and it's another opportunity to get exposure into the area that you see yourself working in. It's a lot of different areas that use CNAs or student nurse techs or techs. If you're not a student nurse yet and you want to get in the field, that's the best way to do it. If you get a CNA job or a tech job in a hospital, a lot of times they have tuition reimbursement. That way you don't have to take out student loans to actually pay for your nursing degree. A lot of hospitals pay large amounts. So even if you have to take out a student loan, it won't be that much. So I would say if you think you want to be a nurse, get inside of a hospital that has tuition reimbursement. I'm just saying, trying to save you some money. We want to take out scholarships. We don't want to take out student loans. student loans will take away all the money that you made as a nurse. I'm thinking about your career. You need to think about what job do you see yourself doing. Me, I knew that I was only going to be good at taking care of babies. That's just like the thing that I love to do. But say if you like taking care of the elderly, or if you like taking care of patients with mental health issues, you will have to do your research and see what area of nursing you want to go in, and then that should help you determine what degree you will need. Okay, so LPN is another option. LPNs are licensed practical nurses. They can do a lot of the things that RNs do. If working in a long-term facility is your goal, then you can become an LPN. A lot of times LPNs do all the care in the long-term facilities, and then they just have an RN sign off on their work. They can do it just a few things, like maybe give blood, but just keep that in mind. If you want to work at a long-term facility, you will usually have an RN that signs off on your work. So you can get into an LPN program. The LPN programs are usually around 12 months, and it could be a diploma program, or you can go through the program at your community college. I tell you again, community college is the best way to go. It's going to save you money, and it also gives you more time with your professors. I don't know, it's just a different vibe at the community college. So if you can start there, I would say start there. Starting at an LPN role is a good idea, but it is limited. If you want to get your RN, you will have to enroll into a bridge program. They have LPN to RN bridge programs that you can enroll in. That way, if you decide later on that you want to be an RN instead of an LPN, LPNs still make really good money, and it's still a lot of positions out there, so you will have a job. It's just really about you deciding what level of nursing you want to go into. So again, back to the community college, but if you want to get your ADN, which is your associate's degree in nursing, you can get that from the community college, and that's the best route. When people ask me, should I be a nurse? I always say, get your associate's degree at the community college, and then if you want to bridge to RN, you can. The ADN is just a more affordable option, and you can get to RN faster. Moving on, if you want to go into management, or if you want to be a nurse practitioner, then you want to get that BSN, Bachelor's in Science and Nursing. The Bachelor's in Science and Nursing is a more expensive program. You will go to university for that, and you will be there for 4 to 5 years. Me, I was there for 5 years. I started my bachelor's degree as a non-traditional student. I just blended in with all the other students. Nobody knew how old I was, clearly older than everybody else, and got my degree that way. So you guys can go, if you're going straight out of high school, you can go to the university, or if you're like me and you start later on in life, in your 20s and your 30s, you can get it done. The bachelor's degree will put you on the track to the MSN, which is your Master's in Science and Nursing. You will go to a university again for that. You will have to pick which nursing program that you want to go into. My Master's of Science in Nursing was geared towards neonatal nurse practitioner, but you can also like do education, or you can also do family nurse practitioner. There's a lot of options to go with that, but that would be your next stepping stone if you wanted to continue. Past the MSN, you will get a DNP, a doctorate in nursing. I'm not gonna say I'm not gonna do that, but I really think I'm not gonna do that. I'm just tired of going to school, okay? And it's a lot of school. So if you want to continue, you can get your doctorate in nursing. All the professors, they have their doctorate. It's a good look, but it's not that much more money if you are just going to be in a clinical role. So you can decide how you want your career to go, what is the lifestyle that you want for yourself, how many years you want to do in school, and go from there. If you know for a fact that you want to get that master's degree or get that doctorate degree, then you know you got to get that bachelor's degree. If you don't think that's for you and you want to stay at the bedside, it's a good option to get your ADN. If you want to do the 12 months, it's a good option for you to do LPN. I have friends in all roles. I have LPN friends, I have bachelor friends, I have master friends, and then I have doctorate friends. So a nurse will always be a nurse at heart. We are there for the patients. We are the advocate. We are the number one advocate outside of their parents. So whichever route you decide to take, just make sure that you are keeping your patient in mind, because that is what sets nursing apart from any other profession. We are the most trusted profession for a reason. Okay, so one of the major challenges I want to talk about that you might experience in these programs. I'm gonna just talk about it because it happened to me, and it happened to a lot of nurses that I talked to, and it happened to almost all my friends, if not all my friends. You're gonna get a professor who tells you it's not for you. You're gonna get it. You are going to get that. You're going to experience that. Somebody, maybe not a professor, but maybe a clinical instructor, maybe a preceptor. Somebody along this nursing journey is going to tell you that nursing is not for you. And I need you to remember why you started this journey. Why did you choose nursing? And prove them wrong. Just a backstory about me. I've had 2 professors tell me that nursing wasn't for me. I did not pass my patho class the first time that I took it at SIUE, and my professor looked me dead in the face and told me that you're gonna have somebody's life in your hands and there's no excuse. And she failed me. And I just want you guys to know that if that happens, you do not give up. You do not give up, because failures are not failures unless you allow them to be failures. You know, a setback can be a set up for the next thing in your life. Do not allow anything that you come across stop you from your dream. If it's a professor, label them the villain in your story and keep it at that. Do not let them stop you. If you fail a class, do not let that stop you. If you want to be a nurse and it's for you, it's for you. Nobody can take that away. So if this is your dream, you know that it's your dream, go and get your dream, sis. Go and get it. It's there. Go and get it. Don't let nobody stop you. Just a reminder for you guys not to forget, I do have an Etsy shop. I created this shirt. You can find it on Etsy. I linked it below. I just want to thank you guys so much for watching this video, and those of you who stayed to the end, thank you so much. Please don't forget to like and subscribe, and I'll see you guys next week on Monday. Bye.